Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. So first on the agenda is a review and approval of minutes from the last meeting. Does anyone have any comments, corrections? I do have a correction, which is that Lee and Aaron were both present at the last meeting via Zoom. Since you weren't here and you watched the video, you may not have realized that, but they were also present last time as well. Anybody else have any comments or corrections?
Move to approve with the stated corrections.
Have a second?
Second.
Excellent. All right, so nice to see a full house for the interns' presentations today. I just wanted to review very quickly, as we've talked about, each month of the year, weeks of the year have different, important health dates. This month in May is the National Physical Fitness and Sports Month. It's also Older Americans Month. And probably most importantly at present, and I'll review a little later when we talk about the county update, is Mental Health Awareness Month. Last week was a National Women's Health Week, but that was last week. David, would you like to give us a communicable disease update?
Starting out with the three communicable diseases that have occupied a significant amount of our time over the last several years, flu, COVID, RSV. Flu season is actually formally over. Remember that flu does occur as random cases throughout the year, so flu season being over means outbreaks or potential epidemics are done for the northern hemisphere for this 24-25 season. If you do get stuck with the flu, remember that antivirals work. The sooner you get on them, the less you're going to suffer from the case that you have and the less likely you are to have severe disease. COVID is declining by every parameter that you can measure. ER visits, percentage of ER visits, hospitalizations, deaths, wastewater, and we'll see how this goes. It is a very different organism in a very different population than it was 5 years ago when it emerged, there's a lot of problematic discussion regarding vaccinations and vaccine development, and there is a substantial wave of medical care that is coming at us in the form of long COVID syndromes. But for the moment, acute disease seems to be in decline, and cases and deaths are at a post-pandemic low. So it seems to have waned dramatically or changed dramatically. And RSV is now, as usual, episodic. It got a little out of whack during pandemic in that there were cases across the year in 2 of the years, but the RSV outbreaks tend to occur in the late fall. Measles, on the other hand, continues to expand exponentially. We hit 1,000 cases of a disease that was essentially by World Health definitions eliminated in the year 2000. We've discussed repeatedly that this is almost certainly related to vaccine hesitancy and vaccine opposition. That position is supported by the fact that pertussis is expanding exponentially as well. Another disease that is in the memory of some of us was a prominent disease causing a lot of morbidity and mortality, was controlled by vaccines and has now emerged as vaccination status has decreased. And that as a consequence, we can anticipate rubella and mumps to follow, and we will have to learn all over again lessons that were learned in my lifetime but forgotten by many of the people who weren't around for the first 30 or 40 years of my life. So keep an eye out on that. But the respiratory transmitted diseases are waning as we hit the summer months, but insect-borne diseases are increasing. Lyme and tick-borne diseases have already started to increase. Remember, prevention, that is, don't get tick bites by wearing long sleeves, long pants, socks, permethrin or picaridin or DEET insecticides. The Lyme particularly, but most of the tick-borne diseases, including babesiosis and some of the others, the sooner you find the tick on you, if you can find the tick on you, and take it off, the less likely you are to have even an acute disease or a chronic disease. And there are primary, latent, secondary, and tertiary stages. And there are excellent treatments, and there are new antibiotic regimens being developed for Lyme in particular. And I think I forgot to mention last time that babesiosis travels in similar spaces as Lyme. And if you have somebody who all of a sudden can't eat beef or pork, get them to the doctor, because they may have had alpha-gal syndrome, which is a meat allergy that is acquired as a consequence of the fact that some of the antigens on the bacteria contain an alpha-galactosidase congener that stimulates an allergy to beef or pork. I think I was going to mention that last time and forgot to. As we're also getting into insect-borne disease season, I would emphasize that travel health is really important as people travel. And I would just mention that there are travel health departments. Penn Medicine at Radnor has a Penn Travel Health. Mainline Health has them, I think, in Exton and I forget where else, Concordville, and that Jefferson as well at their Center City facility has a travel medicine. So if you're going anywhere, really probably anywhere these days, you might want to consider consulting the travel health department of your healthcare system. The last thing that I have to discuss could be listed under old business because it is the response to our public comment our last meeting, and the public comment was that why aren't we talking about avian flu? After I think 6 straight meetings where we talked about avian flu, that was the first time we didn't. But I will happily give an avian flu update, remembering H5N1 is the most common of the avian influenza viruses, but not the only one. And I'm gonna give you what I've got from the CDC website. Bird flu is widespread in wild birds worldwide and is causing outbreaks in poultry and U.S. dairy cows, with several recent human cases in U.S. dairy and poultry workers. While the current public health risk is low, CDC is watching the situation carefully and working with states to monitor people with animal exposures. And CDC is using its flu surveillance system to monitor for H5 bird flu, remembering that there is a significant amount of chaos at the CDC and in the various, the dairy monitoring. So I'm not sure that the declines in current cases are lack of reporting or lack of activity, and that people are, so there are issues with the poultry population, which can cause issues with the availability of poultry meat and of eggs. There are issues with dairy cows, which can cause issues in the supply of beef and milk. They seem to have subsided. And the main reason that people are concerned for human health is the fear that a highly mutable virus will mutate to become transmissible from human to human. Hasn't happened yet, but it's an interesting virus. It has infected so many mammal species and so many bird species, and birds fly, and migratory birds have been a vector to transmit disease to many different mammalian species. So that's my update on avian flu, and thank you all for your kind attention.
I did want to bring up something that is kind of brand new news today. We don't have too much information on it, but and I did not have the chance to read the entire New England Journal article, but there is suggestion that or recommendation from the CDC about limiting who is eligible for COVID vaccines. Age greater than 65, it doesn't look like anything's changing, and there is a pretty long list of conditions that will make someone eligible for vaccination. But I know as myself, fortunately, I don't have any of these illnesses, and I'm not yet greater than 65. I would not be eligible for the COVID vaccine, and having just come from the hospital and seen 3 patients in the hospital with COVID, that's pretty standard, just letting you know. It's not like there's a big outbreak. I'd kind of like to be able to have a vaccine before I go see those patients. So more to come, because like I said, these were just kind of released today, and who knows kind of how things are completely gonna pan out as far as that's concerned.
Well, thanks for bringing that up. I wasn't sure whether I wanted to, because there were 2 things.
I couldn't help myself.
There were 2 things that I saw in the last couple of days related to vaccines, and it tells you the status of where we are. The first was the suspension of the chikungunya vaccine program. Now, I know nothing about chikungunya, but when I see suspension of a vaccine program these days, I do not immediately assume that this was done by people with expertise in chikungunya or in vaccines or in public health or risk benefit. But that, in fact, was a consequence of at least one episode of fairly severe unexpected heart disease. On the other hand, I saw discussions about limiting the recommendations of the CDC for who should and should not be eligible for receiving compensation for COVID vaccines. And it made me want to read the first 2 paragraphs from the same New England Journal of an editorial called "The Power of Physicians in Dangerous Times," and raising that makes me feel like I should. As physicians, we have sworn an oath to reduce human suffering and protect the dignity and well-being of our community. These values are at the heart of medicine. What do we do when this moral code is under threat? In recent months, unprecedented policy changes and massive blunt cuts to U.S. federal funding and the federal workforce have created grave new dangers to health. These seismic shifts have comprised our nation's outbreak response apparatus, veterans care, medical research from basic science studies to clinical trials. These changes have undercut food and drug safety, disaster response, climate change action, and chronic disease management, and have decimated America's global work to save lives from malaria, tuberculosis, HIV, and countless other threats. It goes on, but I felt obligated, I was going to wait till next time, but to bring that up, because so much of what I have to say is shaded by a shakiness, a sense of chaos, and a lack of confidence by what's going on as a consequence of recent changes in our public health care institutions. Sorry.
I think in order to maybe cause a little bit more calmness, I think for the community, I'm looking at this New England Journal writing that went out today on COVID, and they're saying that they are looking to put the onus on the vaccine makers. They're looking to make sure that there is going to be antibodies actually staying. I was actually in a study for this, and so they are looking at immunogenicity. And so they want to make sure, because we are seeing a lot of COVID. We've seen COVID year after year. Oh, I lost my earring. Oh, and that's my earring. And I feel like, I don't think it's a bad thing to stop and take a look. When we look at science, we're always trying to replicate, as Dr. Simon said, we always want to take a study, and we want to take that data, and we want to have somebody else take it and replicate it. And I think that's what we're looking at. I think that kind of creates some kind of fear, or not fear in people when they don't know what's going on.
couldn't be more in agreement. I think that so all vaccines can save your life, all vaccines can kill you. And to understand for each individual whether or not you should take a vaccine, you need to understand what are the risks of the disease you're trying to prevent, what's the probability you're likely to prevent that disease, and what's the risk of the vaccine that you're going to take. I actually believe that COVID has morphed so dramatically from the novel virus that attacked a completely immune-naive population with devastating effects. That's not what it is anymore. And it is really, really hard to determine what is the array of clinical syndromes caused by the current array of viruses that are out there, because for a while now, the proportion of asymptomatic disease among those infected with COVID has increased. But we still know that at the extremes of life and in individuals who do not have the appropriate mechanism to fight disease, there's always risk for these diseases. So I couldn't support more the notion that investigating with sound scientific practices, informed by the past history of scientific practices for development and testing of viruses, could not be more important. The problem is that when I see people saying that you need placebo-controlled studies for next year's flu vaccine, which is a simple change in antigen, and would take a year to do the study, it reflects people who have no understanding of the mechanisms by which this kind of research has to be done. It is frightening to me, and it's a little bit like all the rest of the cuts. It's not a chainsaw process. It's a scalpel process.
I agree. I think they're looking for placebo trial information on everything right now, and I think that's the thing that maybe we thought was already done, but we're looking at that.
Has been, and people who have been in the game a long time and know how to conduct clinical trials know that in some circumstances a placebo-controlled trial is unethical, because the background treatment is so demonstrable as being beneficial to the population that you can't treat somebody who is, you can't take somebody off of their background treatment and do a placebo trial. And with vaccines, when you have nothing but an antigen change in some of the vaccines, and the excipients have already been tested for safety, then different mechanisms for evaluating the safety of the vaccine should be used. But with COVID, for example, we had to move quickly. These were emergency clearances. They were not drug clearances. And I absolutely agree. At some point, we have to back away and say, well, what are we trying to prevent? With measles, we know what we're trying to prevent. We know it is the most infectious agent out there, and we know what happens when it runs wild in the population. And although the probability of death is low, the probability of infection is high, and you don't need a high proportion of deaths to have a tragedy with measles. With COVID at this point, I'm not sure we do understand what the array of clinical syndromes is, and I couldn't agree more. It does deserve a scientific, experienced, and measured medical and public health policy approach, not a political approach.
I think I'm just saying that they're looking for more information and study, and I don't see anything really wrong with that. It's always a risk-benefit analysis for everything.
Well, I agree, definitely looking for more information, but at the same time, if we're saying it's up to the patient if they want to do the vaccine or not, and then we're saying, well, you don't have any of these medical conditions, we'll see what happens long term, because maybe insurances will be like, great, if you want it, you can have it, But I guess the question will be, if you have a daycare worker and they want the vaccine because they get exposed to all the bugs around with the kids, are they able to do that, et cetera? So, just coming up today, I'm not sure we know that for sure at this point.
Can I backtrack for 1 second to ticks and mosquitoes and things, actually? I wanted to comment on that. I think we are seeing a real uptick in cellulitis from insect bites in the summer. And I know we are in our office, we're clearing out now, but we have seen a lot this last 2 weeks. And I would remind people to really keep an eye on any tick bites or any mosquito bites, that they don't turn into a cellulitis, and that they do warm salt compresses on them, keep an eye on them.
Do you think that relates to the alpha strep issue?
I don't really know, to be frankly honest. I just see more, and I know the uptick is in the hospitals as well. I know they're seeing a lot of, not from insect, but we're seeing a lot of cellulitis.
So I would add to that, one of the times that I was most fooled was a theoretically insect-borne cellulitis in an individual with diabetes and multiple antibiotic allergies, and we tried a bunch of different antibiotics for the presumed infectious cellulitis to the extent until we actually found one that she had another bad reaction to. At the end of the day, it was actually a spider bite, and it was a chemical cellulitis from a spider bite, and now I know a lot more about spider bites. And spider bites, not infrequently, cause a cellulitis that is not infectious, but it is rather a chemical cellulitis.
Yeah.
So if you can look closely at the insect bite, if there's a double puncture wound, it's likely a spider bite, and you should not rush to antibiotic management of a spider bite related cellulitis.
Yeah, so I think the warm salt soaks are so good in cellulitis for everybody, just to, before going to anything.
Right, I'm sure we could talk about this all evening, but I think we should get to the highlight of the evening, and in my opinion, one of the highlights of the year, our student intern presentations. I don't know if you ladies decided who wanted to go first. Up to you. If you want me to decide, I can, but. So, is Ian? Yes, let's see if Ian's available to connect. On my way home.
Go ahead.
So stress and anxiety are common feelings we experience on a day-to-day basis. This is especially the case for adolescents who are balancing schoolwork, extracurriculars, and their social lives. Today, I'm going to talk about the important roles physical activity and breathing techniques play in reducing levels of stress and anxiety. So first, I'm going to address what stress and anxiety are, the effects of stress and anxiety and how they affect teens, how teens are currently managing stress, how physical activity and breathing techniques can benefit teens, and then finally I'll end with a poster. So first, I'll start by talking about what stress and anxiety are and how these feelings may be expressed in individuals. So stress is a reaction to external pressure typically caused by a short-term trigger such as AP exams or finals. Dealing with stress can cause teens to be more angry and irritable while also causing fatigue and difficulty sleeping. Anxiety, on the other hand, is a type of persistent excessive worrying that does not go away. For example, juniors in high school may feel persistently anxious about their grades and futures as they approach the college application process. This prolonged sense of anxiety can lead to restlessness, difficulty concentrating, headaches, and muscle tension. Overall, stress and anxiety can cause teens to experience depression, panic attacks, and even exhaustion. Based on these effects, it is clear that stress and anxiety have significant physical and mental impacts on teens' overall health, making it an important topic to raise awareness about. Before getting into how physical exercise and mindful breathing can benefit teens' health, I surveyed 35 people in my grade, asking them what they do to reduce their stress levels. The survey showed that 44% already use physical exercise as a way to decompress, while only 22 use breathing techniques. This showed that there was still a lot of potential for kind of spreading awareness about a specific breathing technique that has more structure and that they can implement into their daily lives. So although I'm sure we all know that exercise is important, I wanted to emphasize its key benefits. Regular exercise has been shown to have immunomodulatory effects, such as decreasing cortisol levels and lowering systemic inflammation, which has previously been shown to balance of chemicals in our brain that are crucial for mood regulation. Exercise is able to reduce cortisol levels as it releases endorphins, which have a mood-boosting effect and can help counter the effects of stress and high cortisol. Additionally, exercise can increase the time spent in REM sleep, which is a phase of sleep that plays a crucial role in various cognitive functions. Better sleep also promotes physiological and psychological processes that allow our bodies to better cope with stress. A research study was conducted with 14,800 undergraduate students who were assessed to determine their stress levels using a shortened 4-item version of the Cohen Perceived Stress Scale. The study consisted of half the students being asked to meet the exercise recommendations of either moderate activity for a minimum of 30 minutes a day, 5 days a week, or vigorous physical activity for 20 minutes but only 3 days a week, while the other group was not required to meet any of these recommendations. After a few weeks, the students' stress levels were reassessed using the same scale, and researchers found that those college students who met the exercise requirements were less likely to report poor mental health and perceive stress than the students who did not meet the recommendations. Physical exercise isn't the only way students can reduce stress. The 4-7-8 breathing technique was developed by Dr. Wheel and is based on an ancient yogic practice called pranayama, which allows practitioners to gain control over their breathing. This control can improve airway health, optimize oxygen-carbon dioxide exchange, reduce stress and anxiety, and overall improve focus and relaxation. This technique consists of breathing in for 4 seconds, holding your breath for 7, and breathing out for 8, and repeating this 4 times. To test the effectiveness of this breathing technique, I asked 35 of my peers to rate their stress level on a scale of 1 to 5, 1 being not stressed at all and 5 being very stressed. And I made sure to do this during school hours, so it wasn't when they were home and doing something relaxing. Before asking them to complete 4 cycles of the 4-7-8 breathing technique, and can be seen on the chart that the majority of people's stress levels were between a 3 and a 4, and some even in the 5 range. However, after completing 4 cycles of the technique, none reported in the 5 range, while more said that their stress levels lowered to between a 2 or a 3. As a part of my project, I created a poster that I plan on hanging throughout the school to allow people to quickly read about effective techniques that they can use to manage their stress and anxiety anytime throughout the day. For this poster, I plan on placing them outside of classrooms, in hallways, in the library where people can kind of just read them and get some information about how they can manage their stress for any upcoming tests or exams. Throughout this year, as I researched the various benefits that physical exercise and mindful breathing have on our health, it has benefited me personally during my junior year as well. The heavy workload that accompanied this school year brought a lot of stress, which at first I found to be very overwhelming. However, I prioritize going on 20 to 30-minute walks a few times each week and also began implementing vigorous exercise through various workout classes. Also, taking a few minutes to breathe before a busy day and use the 4-7-8 breathing technique also helped calm my nerves. Overall, I found it very easy to incorporate these techniques into my everyday life, and I hope the poster can help others do the same. Thank you.
Questions, comments for Alice? I'll start. Just a nosiness. Your pie chart where you had what kids were doing for
Yes.
their stress levels, am I to interpret that 0% said they meditate?
Yeah.
Okay.
No.
Just wanted to make sure I wasn't combining two colors.
Yeah, no, I like listed a few of them,
Yeah.
so like I had options for
Yeah,
them,
you had
and then
options and
someone
nobody
also
picked the
made
one
a
out.
nothing category, which, yeah.
Okay.
I just wanted to comment, that was phenomenal. As a psychiatrist, you really covered a broad and deep array of really kind of all the high points, so I'm very impressed as a high school student.
Thank you. Thank you.
I was very impressed as well. The smoothness with which you delivered that was well beyond what I would normally expect in a high school student's presentation. I do have one constructive criticism.
Yeah,
If you're going to cite a clinical study, I'd appreciate it if you reference the study.
okay, yeah.
Thanks.
All right, yeah.
Yeah, I know that from being in the high school, a lot of times they'll have signs like that, like kind of in the bathrooms or on
Yeah.
the bathroom doors or on boards outside. So that's where you're thinking about involving those.
Yeah, I mean, I always read all of the ones I see, so I
Yeah,
kind
sometimes
of,
they're on stall doors. I
yeah,
know.
yeah.
That's great.
I thought that was great, Alice. You did a great job, and the delivery was amazing. Did you get feedback from your friends or your peers about the poster? Have they given you any feedback?
So I haven't had a chance to hang them up yet, but I did ask Dr. Mack, the principal, and he said it was okay, so I'm planning on hanging them up sometime this week.
Great.
Yeah. Okay.
Maybe also next year, if they're not up over the summer,
Yeah,
Present.
they might get taken down during the summer with cleaning and things like
then
that.
it might be a
Okay.
helpful, beginning of the year, exciting
Yeah.
thing to read
Okay.
and use.
Yeah, that's good. Thank you for letting me know. Yeah, I didn't know that.
Question.
Yes.
First of all, thank you for that project and the thoughtfulness that you presented. It was really excellent and very interesting. I'm imagining that the reason that you were motivated to do this particular project is perhaps because of an opportunity in our schools to address stress and anxiety. But I am wondering how this very simple idea, eloquently executed by you, fits into the sort of spectrum of conversation and interventions that you're noticing at the school. Is there truly a dearth of discussion, none, or is it sort of complementary to or repetitious of something else?
Yeah, so actually, as I was doing this project, I talked with my my ninth grade health teacher, Miss Roseland, and just because I remembered that during freshman year, she kind of did like a unit on stress, and we kind of went over different things that like common, like I guess not specifically breathing, but she just kind of outlined how not overworking yourself and how like various courseworks can help reduce your stress, like kind of in that way. And we also played like stress bingo, which she kind of had like going on a walk, playing with your dog, like different things like that. But for my project, I just kind of wanted to focus more on things that students could, like the 4-7-8 breathing technique, like things they could do right before a test, to kind of help them in that moment, while also like the physical exercise is something that if you do it consistently over like a longer period of time, it can have like a better overall effect on just reducing your anxiety, like in general. But it is something that is talked about, but I kind of felt like it's only during freshman year, and I found it really important that juniors especially be made aware of these techniques as kind of like a refresher, as it is, I feel like, the most stressful year for us. So.
Excellent. Any other comments for Alice? All righty. Next
Thank
up,
you.
excellent job.
Oh.
Yeah, I think Ian heard it.
Yeah.
Good evening, everyone. Thank you so much for the opportunity to speak today. My name is Hannah Kim, and I'm here to share my findings of a project that I've worked on for the past few months. And it's about something every student experiences daily, school lunch, and how this everyday moment can have an unexpected academic and a performance impact on academics. To begin, let's think about a typical school day. Students juggle tests, group projects, class discussions, extracurriculars, and more, all requiring mental focus and energy. Now let's imagine doing all of this on an empty stomach or after eating something that spikes your blood sugar and leaves you crashing halfway through class. Nutrition is the energy behind focus, memory, and sustained energy. While we fuel our students with food that truly supports their brains, we're giving them a better shot at success. But when students eat poorly or not at all, that fuel runs out and their academic performance suffers. And it turns out hunger isn't just a physical problem, it's a learning problem. The USDA clearly recognizes this connection, which is why it has laid out increasingly rigorous nutrition standards for schools. These updates aren't just about limiting sugar or adding more whole grains. They represent a shift towards holistic health, encouraging diverse menus, accommodating allergies and cultural preferences, and limiting ultra-processed foods. By the 2025-2026 school year, there will be stricter sugar limits on cereal, yogurts, and flavored milk. There's also continued support for low-fat dairy, more consistent whole grain use, and flexibility in culturally responsive meal planning. This means that school food is no longer just about filling trays, it's about shaping well-being. Radnor is already doing a great job at meeting these federal benchmarks. Our school provides a balance of fruits, vegetables, whole grains, lean protein, and low-fat dairy. But the question about my project asked is meeting the guidelines enough? Students may be offered all the nutrition they need, but that does not guarantee they're satisfied with the meals, or that they want the meals and that the meals are actually helping them perform better academically. That's where I wanted to dig deeper. The Radnor cafeteria offers daily items such as wraps, pizza, pasta, salads, and burgers, along with a rotating daily menu. While the structure exists, student feedback reveals something more nuanced. Many feel that meals become repetitive very quickly or are very overly processed. Others report skipping lunch altogether because they don't find appealing options. I wanted to understand whether this dissatisfaction could be connected to what happens when students return back to class. To explore this question, I designed a student survey that collected 3 types of information. 1, how satisfied students felt with their lunch. 2, their perceived energy and motivation after eating the lunch. and 3, the academic performance indicators, such as their GPA. My aim was to move past assumptions and gather real student voices and measurable outcomes. So my slide here is a survey of 150 Radnor High School students from across the 4 grades that showed about 20% of students that brought lunch and 80% of students that bought lunch at school. The second question of my survey showed that the majority of the students who buy lunch prefer options such as pizza or pasta, which aren't necessarily healthy. And when the students were asked if they were satisfied with their school lunches, the majority of students, 52%, stated that they were not satisfied with their school lunches. A smaller 37% of students stated that they were happy and satisfied with their school lunches. So my survey also asked students how motivated they felt in class on a scale of 1, not motivated at all, and 5, very motivated after they ate their lunch. And the majority of students stated they were moderately motivated, a 3. And after I calculated how motivated students when they were split into 2 groups, students who were satisfied with their school lunch and students who were not satisfied with their school lunch. And it was seen that the students satisfied with their school lunch felt more motivated in school. So this graph shows the students that were satisfied with their school lunches, and we can see that there are a better percentage of 3s and 4s of motivation. And the next slide shows, the next slide shows how motivated students feel if they were not satisfied with their school lunches, and there's a bigger percentage of 1s, 2s, and 3s out of these students. So this graph shows how much Radnor students perceive that they participate on an average scale of 1 to 5, and most students said that they participate a 2, 3, or a 4, which is moderately participating. The next question was the average GPA of students at Radnor, and most students stated that their average GPA was above a 3.5 and below a 4.0. The average weighted GPA of students who were satisfied with their school lunch options were higher than the students unsatisfied with the school lunches, and this showed that nutritious lunches that satisfy student cravings has an impact on student academic performances. So this is the graph for the students who were satisfied with their school lunches, and there are a bigger percentage of above 4.0 and above 4.10. And this is the graph of students that were not satisfied with their school lunches, and you can see there are a smaller percentage of people who have above a 4.0 and a 4.10 GPA. The results. After collecting survey responses and analyzing student feedback alongside academic indicators like GPA, some patterns became clear to me. First, students who were satisfied with their school lunches tended to perform better academically. Their GPAs were consistently higher, suggesting a link between how students feel about their meals and how they perform in class. But it wasn't just about the grades. Students who felt good about lunch also reported feeling more energized and motivated throughout their school day. They were better to concentrate in class, especially in the afternoon when focus usually dips. And this shows us that the lunch period isn't just a break, it's a critical reset point that can affect how students learn for the rest of the day after lunch. A welcoming, nutritious lunch, one that students actually enjoy, can support their overall academic success. So in addition to national research, international data also backs the connection between diet and academic performance. A large-scale study for the Research and Action Center looked at over 46,000 adolescents in 42 countries, and what they found was consistent. It was that students who regularly ate fruits and vegetables and didn't skip breakfast were far more likely to report stronger academic performances in school. But this study went beyond just GPA. It found that students who ate nutritious meals also had greater sense of emotional well-being. That is, the belief that they could succeed. That's important because when students feel physically and emotionally supported, they're more likely to participate, persist through challenges, and contribute in the classroom. So the vending machines outside of the cafeteria play also a big role in what students eat during the day, especially if they skip lunch or don't like the offered options in the cafeteria. Right now, most vending machines in Radnor offer snacks like chips, candy bars, soda, and sweetened drinks. While these are common in many schools, they're not designed to fuel learning. Instead, they provide short bursts of energy that can crash quickly, leaving students feeling sluggish when they need to focus most, such as during afternoon classes, extracurriculars, or testing periods. The presence of these snacks also send mixed signals. If we teach nutrition in health class but surround students with junk food in the vending machines, we undercut the message and reduce their ability to make healthy choices. So I surveyed the students to see how many students have snacks at school, and we see the pie chart that almost 90% of students said that they do have a snack in school. Out of the approximately 87% that stated they have a snack in school, 74% of the students said that the snacks were from the school vending machines. When asked what kind of snacks they buy from the vending machines, most students answered junk food such as chips, candy, and soda. A simple yet impactful solution would be to stock vending machines with smarter snack options. We're not talking about removing choices, we're talking about offering better choices for the students. Healthier vending machine options that students also suggested in the survey included trail mix with dried fruits and nuts, whole grain options such as granola bars, air-popped popcorn or baked veggie chips, dried fruit or low-sugar fruit leathers, water or flavored seltzers instead of soda. These snacks still satisfy cravings and provide variety, but also deliver more stable energy, helping students stay alert and productive through their school day. When students were asked if they felt that the food they ate impacted their academic performance and social well-being, 80% of the students responded yes. This proved that students wish for healthier and better lunch options at school to improve their academic performance and social well-being. So one of the most encouraging parts of my research was hearing directly from the students from the survey and just asking around what they would prefer. When asked what they like to see in the school meals and snacks, students offered thoughtful, reasonable feedback, not just complaints. Here's what they consistently asked for: less processed food, more fresh fruit and vegetables, more gluten-free, low-fat, and low-dairy options, and more variety in global cuisines. This shows that students are not only aware of their needs, and they're eager for change. As I wrapped up this project, one thing became incredibly clear: school lunch is so much more than just food. It touches every part of the student's day, how they feel, how they behave, how they learn. And when we get it right, the impact ripples outwards. Improving the quality and inclusiveness of school meals, even in small steps, sends a powerful message to students. Your health matters, your experience matters, your success matters. These changes aren't just nutritional upgrades, they're academic investments. They support not only better focus and GPA outcomes, but also better mental well-being, confidence, and trust in the school system. Many of these adjustments are practical, affordable, and already aligned with federal nutrition guidelines. So when we consider school food policy, whether it's vending machines, menus, or education, what we're really shaping is the foundation of student potential to grow. Thank you so much for listening to my presentation today and for the opportunity to share with you. I'd also like to express my sincere gratitude for being selected as a student intern for the Radnor Board of Health this year. It's an honor to be part of this team and contribute to the meaningful conversations about student health and wellness. Thank you.
Excellent job, Hannah. Anyone have any questions, comments?
I was just going to say, really, really great use of data and just very well delivered all around.
Thank you.
How did you get the students to participate? Was it through?
So I basically sent it out to my friends, and I also said to hey, if you know anyone, let me know. And also I just during class, especially after APs, we don't really do that much in class. I kind of went around and was like, hey, can you fill this out for me?
Yeah. So I know it's hard to get a school-wide survey, but I'd be interested to see, a school-wide survey if it was able to be done, because I wonder too if like, wow, everybody's grades were really good, right? But there's probably, like you're saying,
Very,
like
very,
after
very
AP
good.
tests and
Yeah,
such.
so
it's
it might have been a
probably,
little
you
bit
know,
skewed.
it might be a little bit skewed. That's fine. You
Yeah.
do what you can with the data you have,
Yeah.
right? And then you think about the limitations of that data. And, you know, another thing is a lot of times you know, think about what would be future areas of study. And exactly that.
Yeah.
That would be future area of study to
Yeah.
kind of pull everyone to see once some of those changes hopefully would be able to be implemented.
Yeah.
Is there any change in the survey, et cetera?
Yes.
It's excellent.
Thank you.
Hannah, that's a great job.
Thank you.
Very much. I just wanted to say that I think the trend today is that younger people are looking more and more towards healthy snacks rather than having the chips and the pretzels and all those things in the vending machines. And I'll just say from personal experience, I have 24 residents that are like 25 to 32, and we supply snacks for them to survive during the day. And none of them want chips or pretzels or cookies or things like that. They want trail mix and other things that are healthy snacks. So I think it would be a great idea to get those bad snacks out of the high school and get some good stuff in there.
Thank you.
And I just have one other comment. When you're talking about like your statistics, you should be careful saying words like prove, because you're not really proving anything here. You're just stating relationships.
Okay. Yeah. Okay. Thank you.
Question. So I think that you did make an effort to ask students what kind of foods they would want.
Yeah.
My experience as a primary care physician is that many people say that they know what to eat, they just don't do it. And it sounds like a hackneyed thing that everybody seems to say. I'm just wondering to what extent you got the impression, or you have the impression, that students not only know what they should be eating, like sort of recitation from their health class, but how to assemble a healthy meal. Like, would they know how to put together a healthy meal? Would they know how, like, could they picture what a healthy meal would look like that they would want to eat?
I think that some students were like my survey, some like a very like few amount of people, they like I asked what they would want, like changes in the cafeteria. Like a few people said more mozzarella sticks, more mozzarella sticks, more mozzarella sticks, 3 times in like all caps. And I was like, okay, so like I think there were different types of people that responded to the survey, but I think that like more people than I thought knew that they wanted to eat healthier, but they just like didn't really know how to, or like they didn't really know what to reach for in the cafeteria. So I think just like maybe like during health classes a little bit more education. I think we talk a lot about drugs and alcohol in health class, but we don't really talk about nutrition that much. And I think a more like skewed towards like a maybe like a unit on nutrition in health class and just like more healthier options in the cafeteria can really change the eating habits of students at Radnor.
Right, at least just having those options available.
Yeah.
Maybe people aren't choosing them, but hopefully some would. It would be good to have that option available. Excellent.
That was a great job that you did. I think people are starting to realize that food is medicine. Food is either going to affect our bodies in a good way or a bad way. And I agree, I think trying to maybe influence those snack machines are better choices. It's a great start. Were they receptive to that? They have, I'm sure, staff that try to choose healthy.
Yeah.
Yeah.
They have vending machines that say healthy snacks on them, but it's like not really much different from the regular vending machines. So I think there needs to be some change.
Excellent. Well, thank you, Hannah, very much.
Thank you.
All right, so since we're running late, I'll kind of go through the last few items quickly. I am going to give a little presentation about GLP-1 agonists for diabetes, but specifically more weight loss at next visit, kind of just general knowledge and thoughts. Bringing us to new business, for our school liaison, Jenny had a death in the family and was not able to be here this evening. Maggie, do you have anything to bring us from the Board of Commissioners?
Well, I will be brief. Again, we've done mostly land development, but we did shockingly on, I guess, the 12th, not the meeting yesterday, but a week ago, put forth an introduction to an ordinance that will require dogs to be on leash in the Radnor Township parks. Except for Hartford Park, which is a dog park, Friends of Radnor Trail, also a dog park, and the Skunk Hollow ordinance that we previously introduced, which requires on-leash for certain periods on Saturday and Sunday and holiday afternoons. A lot of people aren't happy, but I think that it was the right thing to do health-wise. So. And that's about it that we've done along these lines.
I just have a quick question while we're on school liaison, since it's on top of mind. Is there any potential to ask for the ability to do a school-wide survey on behalf of the students for the future years? Whether people actually fill it out, obviously, or not?
It kind of depends on what the administration, I feel like. I know like 3 years ago, we attempted to get some school-wide surveys and did not happen. Last year, there was a survey that was put out through Schoology. That was a school-wide survey that did require like going through the school board to get it approved. So it's like a multiple kind of step process. So to the extent that like last year we were like, don't do a survey, but somebody was like, oh, I can make it happen. And they did make it happen. So that's why we've kind of been like a little more okay with kind of, less scientific surveys of surveying everyone, just because of those limitations.
Yeah, I just wonder if, as a resource for the students who are invited to participate in this program, if that's something we could work on with,
Yeah. I think that would be an excellent idea, kind of presenting to
ongoing,
administration, kind of
yeah,
discussing with
as part of
them
this
strategies.
program.
Yeah, I think that would be great. So just a few words for the county update. The big thing in the county doesn't affect us too much, but the ongoing challenges with the closure of the Crozier Health System. There is a good, on the website for the Department of Health, they have the number for the Delaware County Wellness Line. So if people are wondering where they can have short-term or long-term assistance, they also have a notation on there about when to determine whether you should go for ER care or urgent care. So little, recommendations based on what your symptoms are. I know that there's a real challenge right now with having the patients whose primary care doctors were in the Crozier system being accepted as new patients in other areas. Of course, that's a little more south in the county, but I do think it's going to influence this area more and more as those patients are trying to find care. They also, really interestingly, on the website for the county, published the Community Health Improvement Plan, and this was something that we talked about last year. There were listening sessions. You could do surveys online, kind of looking at what the concerns of the community in the county are, and basically they released a guide to address key health priorities. It's, so many pages talking about specific percentages that they would like to reduce the maternal mortality, et cetera. But pretty much their, key findings were that the three largest areas of concern were mental health and substance use disorders. That people ages 25 to 34 had the lowest scores for mental health in connection to others. Access to care for mental health is a challenge in the county in general. And I would say around here, we do have a lot of mental health providers, but a lot of them don't accept insurance, so it limits some people's ability. The second was to promote maternal, paternal, and infant health. More babies are born here in Delaware County without prenatal care than the percentage in Pennsylvania. So, and then the third area was helping to prevent chronic diseases. So I'm talking about chronic diseases account for 6 of the 10 leading causes of death. Our rate of deaths due to stroke is significantly higher than the rest of Pennsylvania. And talking about trying to increase mammogram screenings specifically. So if you were interested in that, you can kind of check out their full recommendations. But I thought that was interesting to see kind of that data come to light, because that had been done. There were focus groups, there were community conversations, there were surveys done, and they reached about 5,000 total community members. All right, so brings us to public participation.
I'm not public, but can I just add one more thing about Crozier? Because our fire and EMS people are looking very closely at emergency transports of various kinds, because a lot of emergency transport was done by Crozier Chester. And even though we are relatively far away from that area, it still may very well impact ambulance service within Radnor, because if one of our ambulances has to go all the way down toward Chester, it's, there are only going to be a couple more to back it up, and you get 2 down there, and then you have no ambulances here, and we're dependent on Narberth for backup. So response times, they always keep careful track of that, but they're looking at it as, then and now. So we'll see.
Excellent. Thanks for that, Maggie. Interested to see if there's any change. Does anyone have any other comments, concerns, anything they want to bring up? Our next meeting is actually Monday, June 9th at 5:30. It is not the third Monday in June. It is the second Monday in June, so I just wanted to point that out. Anyone want to move to adjourn the meeting?
Move to adjourn.
Second.
Second? Excellent.
I would just add, since we're out of the meeting, that we have started the first of 10 straight